Do you struggle with neck pain? Is it something that might be acute because you just woke up funny and now you can't turn your head and you've got a pinch? Or is it something that you've been dealing with as a chronic issue? Either way, what I want to talk about today are two possible options for therapeutic intervention if you've gotten to that point. We're talking about massage therapy versus chiropractic. I want to go through basically what they are, what they can offer, some of their limitations, how to distinguish whether you have a muscle issue, bone, or nerve impingement, and then some considerations. Welcome to Dialectic Healing, where we discuss a fusion of physical and mental therapies so that you can obtain and maintain your healthiest self. But before we get into the content, I want to give you a resource. If pain is something that you have struggled with, not just neck pain, but pain elsewhere in your body, then download my 30-day pain-free jumpstart guide. It's totally free. Just follow the link below. It will give you bullet points of things you can do at home and within your free time to help start alleviate your pain, no matter where it is. There's this misconception out there that pain is inevitable, and I am here to tell you that that is a false narrative. And I don't believe it for a second. You do not hit a certain age and then your body just falls apart and you're doomed to deal with pain for the rest of your life. I have never had anyone come into my office and I just tell them, well, I guess you're just going to have to deal with this forever now. I refuse to believe that. And so I want to offer you my 30-day pain-free jumpstart guide so you can start alleviating your pain at home. And then with some of the information that I'm giving you today, you can decide whether massage therapy or chiropractic work can help you further that progress. So let's get into the content today. Okay, first thing, let's just break it down very simply. Chiropractic work primarily works on adjusting the bones. That's really what it does. Mainly the spine. If you need adjustments in other areas of your body, chances are you've dislocated a joint versus just subluxed an area that needs to be put back in place. And that's where chiropractic comes into place. And we'll get into more later on how to know about when that's happening. Massage therapy, plain and simple, that works on soft tissue, whether that be your fascia, muscles, tendons, ligaments. The focus is on all the soft tissue and connective tissue and manipulating that. Now this brings me to where some of the limitations are with each of these therapies. Obviously, if you do have a bone out of alignment, massage therapy is not necessarily going to put you back into place the way that chiropractic could. Now, a lot of chiropractors are now staffing massage therapists because bones don't have a say. Muscles kind of dictate where the bones go, not the other way around. So if a muscle is really, really tight, it is going to continue to pull that bone out of place. So not addressing the soft tissue issue and the tightness and the tension that you might be having in the limited range of motion could be coming more from the muscles rather than the bones. But if you do have a bone out of place, you will know because you won't have the full range of motion that you're looking for. There'll be a kink, like it'll just like stop. All of a sudden you're gonna have bone meeting bone and it just isn't functioning properly. That is where a chiropractor is going to help tremendously because they can quickly put those bones back into place and then allow those bones to effortlessly move the way they should. And the muscles can move and dictate where those bones go in a nice, smooth fashion. But that's where it kind of becomes this distinguishing factor. Is it the bones are out of place? Is it the muscles are too tight? Do I have a nerve impingement? Now, the best way to know if you have a nerve impingement is if you don't actually have local pain in the neck. So the brachial plexus does come out from C3 to T1 almost. And it comes out, goes down the front part of the shoulder and down into the elbow, where it breaks off into the ulnar and radial nerve and goes down into the hand. If you have a nerve impingement, you could be feeling that nerve pinched, where you're going to get sharp pains, numbness, tingling anywhere along your arm. This is where a lot of people get misdiagnosed for carpal tunnel, because they have pain in their wrist or in their fingers and things are starting to go numb. One very distinguishing factor here is, does it go numb all the time? And that might be where it's pinching off at the spine. Or does it go numb because you woke up and you realize your arm is asleep, but then as soon as you start moving and you start waking up and start moving around and using your muscles, if that numbness and tingling goes away, then it's more likely that the muscles themselves are actually putting pressure on the nerve. So it's not just bones that put pressure on the nerve, the muscles can too. And that's where we would diagnose you with thoracic outlet syndrome versus an actual pinched nerve in the spine. So these are distinguishing factors, understanding which is which. Now, sometimes it could be both. Sometimes you might have a pinch coming from the spine and you're feeling it down in your hand, your elbow, your forearm. And sometimes it has nothing to do with your spine or your neck, and the pain actually resides somewhere in your shoulder or in your arm that's pinching off the nerve, causing these numbness and tingling feelings down in your finger. Now, if it's these three fingers, then it's your radial nerve. If it is the last two, it's your ulnar nerve. And at that point, we're looking at different areas down the arm that are getting pinched off versus just up here. Again, this is another distinguishing factor between if your whole hand is going numb, then it could be coming from your neck. If it's only these 3 digits or these 2 digits, then it could be pinching off somewhere in the muscle, in the shoulder, in the elbow, causing pinching in the radial or ulnar nerve. Now, some considerations here, mainly understanding that I've never met anyone who only needed one therapy. Now, a lot of people are like, well, should I do this or should I do this? I'm inclined to say maybe try both, because maybe you do have a subluxation somewhere in your cervical vertebrae, and an adjustment plus a massage might be exactly what you need, which is all that needs to happen, and alleviates that pain, alleviates the radiation of numbness and tingling or sharp pains down your neck. Possibly you need a few therapy sessions. The more chronic your condition, the more likely it is that you're going to need more than one session, either with chiropractic or with massage. Both are designed to kind of work quickly with acute stuff. The longer it progresses, if you've become more chronic, then again, I revert back to my 30-day jumpstart guide. There are a lot of things in there that will really help you to work on your posture, to work on your strength, to work on your diet, and work on some of these things at home that can actually help incorporate into some of the therapeutic stuff that you're having other therapists work on with you. So I really want you to understand that some of the considerations might be that maybe you need both. Maybe you need a couple of things. And in later videos, I actually talk about the difference between maybe physical therapy versus massage, or acupuncture versus chiropractic, because there are a lot of other therapies out there. So check out some of my other videos when we talk about other therapeutic options for your neck pain. I hope this was helpful for you. Check out some of my other videos. Make sure you subscribe, and may your pain be relieved.